Good evening, everybody. My name is Beth Duboff. I'm the Executive Director of NAMI Rockland, and we welcome you tonight. In order to get to what should be a really informative program, I am going to save my remarks about NAMI Rockland for the end of the program. At this time, I'm going to hand it off to Jackie Drexler, who is going to introduce our speakers for the evening. And I will see you again later. Enjoy our program.
Okay, welcome everyone. I'm Jackie Drexler, and I want to thank the board members who are attending, you, the public, and to any of our elected officials who are also on this call. As chair of the Legislative Advocacy Committee, I want to thank the committee members, and special thanks to Robert Schmelter, our community outreach coordinator, who's the man behind the curtain tonight. Before I introduce our speakers for tonight, just a few housekeeping items. One, if you could keep your microphone off, that will help stop feedback, chatter, and echoes. This is being recorded, so if you don't want to be seen, then you need to turn off your video. Also, if you feel the need to move around, as sometimes we do, again, turn off your video, and when you come back, turn it back on. We will be taking questions after our speaker's presentation, so please put your questions into the chat. If you don't have chat availability and your question doesn't get answered during the Q&A, please email us at info@namirockland.org and we will respond to you. If you are hard of hearing or have a hearing disability, look for the 3 dots or 3 bars and click on that, and then you can click on closed caption added. So, legislative advocacy, what do? We advocate for better health care, parity for mental health, better pay for all workers in the health and mental health fields. We sign petitions, write letters to the governor, and inform the public and our elected officials of issues that concern all of us. We work with the goals of NAMI New York State legislative agenda, and we also focus on local issues. We work towards breaking the stigma associated with mental health issues. And speaking of breaking the stigma, we are already promoting one event, NAMI Walks event, to be held in September at Rockland Lake. And we are also starting to promote our Breaking the Silence event, which will be in October. So what I'm going to do right now is I'm going to introduce our first speaker. And then when it's time for a second speaker, I will introduce him. Our first speaker for the evening is Dr. Susan Hoerter. She's dual board certified in general psychiatry and child psychiatry. She completed her residency and fellowship at the University of Massachusetts Medical Center, where she served as the chief resident. A graduate of North Rockland High School, she returned to Rockland after completing her child psychiatry fellowship and began working for the Department of Mental Health in the outpatient clinic as a child psychiatrist. Then became the medical director of the Rockland County Department of Mental Health. Dr. Hoerter was appointed as the acting commissioner in 2020 and continues in that role today. Dr. Hoerter will be speaking of some of the state projects and her and the department's priorities on local initiatives for Rockland County. Thank you very much, Dr. Hoerter.
Thank you, Jackie. Good evening, everybody. I really appreciate this opportunity to give you an update on what's happening here in Rockland at the Department of Mental Health. So also thank you, NAMI, for having me, and thank you for all of the work that you do. I wanted to start by saying that similarly to NAMI, we had a forum last week. We had our second annual Behavioral Health Community Forum, and it was virtual. And the purpose of the forum was really to gather community input and ideas on behavioral health needs in our community. And the timing of it coincides with May being Mental Health Awareness Month, and also with it being the kickoff for our, we call it our local services planning season. So every county in Rockland, I'm sorry, every county in New York has to do a local services plan and update it annually. So Behavioral Health Forum is really our opportunity, the one that we had last week, to hear from the community about any needs or ideas, things that people are identifying that could be helpful in the community. So from that information, in addition to information we gather throughout the year via work groups where we meet with stakeholders monthly in various service areas. So we have a child and adolescent mental health work group, an adult mental health work group, a work group for substance use disorders, and also one for intellectual and developmental disabilities. So that's kind of how the department is organized. So in addition to what we heard last week and what we hear throughout the year, we then use that information to update our local services plan. That's available online. Every county, you can look at every counties across New York State if you want to, but they're out there. So I wanted to take this time to update everybody on what is happening in Rockland. Like, what are we working on in our local services plan? And so there are a couple of larger projects that we're working on locally. So before I talk about the local projects, I just want to say something about the Intensive Crisis Stabilization Center. Probably many of you have heard about this, right? So that is a project that is going to be jointly licensed by 2 state offices, the Office of Mental Health and the Office for Addiction Services and Supports. So if you know anything about how state licensure works, it is pretty time intensive, right? It's not a quick process. And to have a program that will be duly licensed and reviewed, as you can imagine, right, comes with a lot of challenges. So that project is in the works, but still probably, I would say, 12 to 18 months out if I had to guess. And I'd like to give an update because it has been something that we've been talking about for quite some time. And we kind of don't talk about it anymore too much because we're always saying it's another 12 to 18 months out. It's out of our hands, unfortunately, for the most part. We do meet with the local agency that will be the provider, and the provider is Samaritan Daytop Village, which is located in primarily, well, they're quite a large agency. They have a large presence in the city, but locally they're in Blauville. That is happening still. It's still in the works. It's coming, but not for a while. Something that here are the things that actually are happening now. So we are looking at our 311 call center. We've also been talking about 311 for some time. You may remember that in the past, there was a behavioral health commission report completed. And one of the identified needs was having a single point of contact for behavioral health services. I think most people here will know that the behavioral health service landscape is very intricate and not easily navigated, right? So it's hard to know how to enter. It's hard to know where to enter. It's sometimes hard to know what it is that you're looking for. You may not know, what is the best fit. So, you may not know about partial hospital or about day treatment programs or about pros or about different support groups in the community. And the landscape of services and who's providing what service to which ages, at what hours, taking which insurances is constantly evolving, right? So, we have tried different approaches to try to keep this current, such as a website, et cetera. And, we have a resource card. Probably many of you have seen the resource card, and that's a good reference, right? So if you keep that on your fridge and you need to know the number of your clinic that you're going to or a family member is going to, it's a good reference point. However, it does not really explain, it doesn't explain how to access services. It doesn't tell you where to begin. And we really felt that the best way to accomplish that would be to have a human on the other end of a phone, right, who could actually talk to somebody and like kind of work it out with them, right? Like, so what is it that might be beneficial? And so we are opening a 311 call center. We learn a lot in our region. We're very fortunate in the Hudson Valley region of New York that we have excellent services in the counties around us have very well-developed services, and we learn a lot from them. So we saw this at work in Orange County, and we're very impressed by it. And it's been really an excellent program. So we are emulating a program here in Rockland. We anticipate that opening probably in the next 3 to 6 months, I would say. So the call center, the 311 call center will open. We will be advertising heavily as you would anytime there's a significant change in the system of care, right? So that's really significant because we're really changing the way people access things. A lot of times when I talk about 311, I'll get a question about, well, what about 988, right? What does that have? How does that work with 988? And that's a really good question. And the best answer is that there's no wrong phone number, right? So you can call 988. 988 for Rockland County is actually answered by an agency out in Suffolk County. That was something that the state decided. So, you know, you can get it. They're a very competent agency. They're competent people working for them, but it's pretty far removed from here, right? So it's not necessarily a good connection to our local landscape. It's a good support number, and they actually do get many calls from Rockland, more than I thought that they would. But we would like to develop a resource locally that can help really with anything behavioral health. So the goal here is to simplify the message for the whole community, right? Like, how do you begin when you have a behavioral health need? And when I say a behavioral health need, I really mean any behavioral health need. So it could be you have yourself, maybe somebody themselves is looking for detox. Maybe somebody is looking for a partial hospital. Maybe somebody is looking for a geriatric psychiatrist for their parent, or, you know, a cognitive behavioral therapist for their 12-year-old with anxiety, right? So those things are not easily navigated on a website. So we really felt that the best way was to have, again, like a live call center person. And these people will also be clinical people, right? So that in addition to being able to answer questions about information and referral, it also will be the number to call for a crisis, right? So that will be like, again, anything behavioral health related, you would call this number, right? And a person will answer. And if you need a crisis service, they will coordinate that. They will connect you, or they will actually call the crisis service and dispatch them, right? So they're going to dispatch crisis services. They're also going to be available for information and referral. And then there also will be peer follow-up. So 7 days a week, 7 or 8 hours a day, depending, there will be a peer, a mental health or substance use certified recovery peer who will follow up with callers to see if they have connected with services. So, so we're really excited about 311. It's a big project. I encourage everybody to, you know, if you need to use it, we'd love to hear any feedback when it does get up and running. If it's good, if it's not good, we need to know. We really do hope that this will simplify. It's a very simple message, right? And hopefully it will really simplify access and navigation of the behavioral health system. And again, when I say behavioral health, what we, you know, our name of our department is the Department of Mental Health, but really what we cover is behavioral health. And by behavioral health, I mean mental health for children and adults, as well as substance use disorder treatment, as well, and prevention, as well as services for people with intellectual and developmental disabilities. So that's probably the biggest thing we're doing this year. Some other questions. I'm sorry, some other things we're working on. We also began the Rockland Behavioral Health Training Institute this year. So this is a new endeavor. This is a training arm for our department. We have a contract with an agency that administers this program. They bring in speakers. We have had, I think, 4 lunch and learns now, which is a free 1-hour training on various topics. I actually did one on involuntary transport orders or police letters, if you're familiar with that terminology. And then just yesterday, we had somebody do one on exposure and response prevention for children with anxiety. And we've had a few other ones. So these are really good resources. They're free. And the Training Institute is able to provide continuing education units for several disciplines, including licensed marriage and family therapists, licensed mental health counselors, psychologists, social workers, and also licensed psychoanalysts. We looked into psychiatry, but it's a little bit more complicated for physicians. So it's something that we're looking at. But the goal with the Training Institute is to really work towards having a very well-trained workforce that has an opportunity to access free or low cost, really mostly free trainings, because we really believe that having, a lot of times there's a disconnect between what's happening in research and what has been shown to be an evidence-based practice and what actually gets delivered in the community. So, we know that people do better when they're getting evidence-based treatments, generally speaking. So we really are trying to really infuse evidence-based treatment throughout the community, right, through our community providers, and also to make sure that treatment is as high quality as possible. And I think also this is an opportunity to really let the people working in community mental health and throughout Rockland to feel supported, right, to have an opportunity to train and learn, which I think is generally good for morale, which is probably good for people receiving services from that individual. And then also gives them an opportunity to kind of, see other people on the call, talk about questions they may have and really discuss the topic. So we do have actually a really exciting, it's our first full series coming up in the Training Institute. We've done Lunch and Learn so far. Again, this all started this year. We have a very extensive cognitive behavioral therapy training coming up with children, for children. So we have an excellent speaker who we've seen speak before. And that will take place over, I think, like 6 sessions throughout the rest of the year. And there'll be CEUs for that. So we're really looking forward to that. He's a great speaker, Dr. Bob Friedberg. He's very well known and just really going to be a great training. So we're excited for that. Okay, so we are also this year, we just put out an RFP to consolidate our crisis services. If you are familiar with crisis services in Rockland, we have the BERT team, and then right for mobile crisis. And then by using the same number, you can also access what's called the Children's Care Team, which is a service that can come out and do a crisis evaluation, but also can stay involved for up to 8 weeks with a family and a child to help stabilize them. So both services are funded by state funds. So they are insurance blind, which basically means they don't bill, right? So there's no cost. There have been changes to the state guidelines on mobile crisis for mental health. And in line with those changes, we felt it no longer made sense to have 2 separate programs. So we are consolidating into one program. So that will be happening probably early next year, if I had to guess when it would start, but don't hold me to that. So it's a big, again, another big lift. And then we are also, we had a program before where we funded DBT programming in schools, and we are restarting that with a new provider. So that will be starting fairly soon. We are starting with the South Orangetown School District, and we will go on from there. So that's the school district where it was previously being done. So we are kind of completing that part. And then the goal is to roll it out across other school districts as they show interest, and to really have DBT kind of infused throughout our school districts in middle schools, and then, eventually to the high schools too. So that's something else that we're working on. Recently, we just started a reentry program. So Bridges is an agency that you may be familiar with in the community, and they previously had a state grant to provide reentry services for people who are being released from Rockland County Jail. Their grant ended, and so Rockland County Jail for some time now has been without a reentry program, which means that there are some discharge coordination services, but nothing specific to mental health or substance use. So this reentry program we're contracting with Bridges, and what they are doing is that they are working with people when they're in the jail to set them up so that they can be successful as they're released from jail, and to really reduce people returning to the jail, so that they're going to be supported by having appointments set up. They're going to be having help getting really on their feet. Right. It might include things like helping them get identification, like, looking at things like, do they have food? Do they have clothing? And then also following up with them in the community to see if they connected with their mental health appointments or their substance use disorder treatment appointments. So that just is starting now. So it's staffed up. So that is beginning now. And then finally, there are other things, but the other thing I wanted to mention was opioid settlement funds. Our department is charged with managing and spending the opioid settlement funds in Rockland County. So the large majority of the funds are being used here to fund the 311 call center, which was also a need that was identified in our community forum on opioid settlement funds. So that was probably done like 2 years ago, that forum. And we, took in a lot of information about what people felt was needed, and this was a need, this single point of contact. So that's where a large majority of the funds are going. The funds are also being used to fund Oxford House. Excuse me. Oxford House is an evidence-based, SAMHSA-supported, peer-run recovery home. And so there is one house for men in West Nyack, and most recently there's another house for women that opened in Suffern. This is again a peer-run recovery home model, and we are hoping to open some more of them as time goes on. So that's the update from Rockland. So any questions, I'd be happy to take some before I have to go. Yeah.
Well, Dr. Hoerter, that's a whole lot of tremendous news. Some things that we seem to still have to have patience for, and then other things that you've already engaged in and that are already up and running. Thank you for all of the information, and I'm going to just turn this right back over to Robert for questions, and thank you for coming.
Yes, absolutely. Thank you for having me.
So far, there are no questions in the chat, but if you have a question, it looks like Anita does, so let's turn it over to her.
Thank you, Dr. Hoerter. Lots of information. I think I may have missed who's the other collaboration between Daytop and who will be the mental health entity or provider attached to the crisis stabilization?
Oh, so that
center?
actually is a state, it's a state-run, to state contract. So Daytop will be hiring both mental health and substance use disorder personnel. So Daytop runs mental health programming in other locations. So
okay, so that's a change from the original grant that was written a while back. There was a local mental health provider. Okay, thank you.
Do you mean Achieve? Is that what you mean?
Yes, yes.
Yeah, Achieve is still on the list, but Daytop is coming to the forefront.
Taking the lead. Okay, thank you. That's helpful.
Okay, we have a question in the chat. Amber would like to know, would you be able to re-explain the two licensed programs you mentioned consolidating?
Sure. So right now we have a mobile mental health crisis team called BERT, right? And then we also have the children's care team. And so this is an effort to consolidate those two programs into one program. So it'll be one program that is for really all ages. And one of the key reasons for this change is, one, the state is expecting mobile crisis providers to begin billing for when people have Medicaid. So that's one reason for the change. The second reason for the change, this is probably primary, is that the state changed their guidelines for mobile crisis. And one of the hallmarks of our children's care program, which was significantly different, was that it followed a model called mobile response and stabilization. And one of the hallmarks of that was that the provider could remain involved for up to 8 weeks, right? So that they could go back to the house, go back to the family, right? Like meet with them, help stabilize the family or the youth. And that was unique, right? And then the state changed their guidance, and now the new mobile crisis guidance from OMH allows all providers to remain involved. So that is a significant change. So we think that that has been a really good positive thing in the care team. So we would like to be able to have that for adults as well. So by consolidating the programs, it will be available to youth and to adults.
Okay, I see Jossie has her hand up, so we'll go to her.
Yes, thank you so much for being here. We all really appreciate it. I was curious about the DBT program that you were talking about for children, for younger children, and I wanted to know a couple of things. One is, what grade does that start in? Mm-hmm. And I'd like to know, was there grant? I think you said there were grant monies for that, but they might have run out. And
Oh, that was actually the reentry program. So the reentry program was funded by state funds in the past, and then that ended. But the DBT program it starts in the middle school, so 6th grade. And so it works through the middle school, and then once the middle school is kind of up and running, then it will go into the high school. And again, the plan is to start with DBT programming in the middle school to we are using a mental health agency to go in and to start working with teachers, with the clinical personnel, with the students to introduce that in the school setting. And then also the other part of that program was we also asked the agency to do some DBT skills groups in the community, because I think that what we see sometimes in the community is people have an established psychiatrist and therapist, sometimes, in an outpatient practice, and then they might need some DBT. And then, sometimes they're required to leave their existing providers. And we wanted to be able to have the opportunity for people to get some DBT skills training in the community without having to leave their existing providers. So that's another thing that we're looking for. But yeah, DBT in schools will unfold that way.
And how long has that been occurring in the schools with the DBT?
It was going on for a short period, a period of time, and then the contract ended. I think the agency didn't renew, and then now we look for another provider. So we changed.
Okay. I was wondering if there were any measurable, differences. Okay. I think it's great. I wish it would start in, kindergarten and 1st grade.
Yeah. I agree.
Yeah. Anyway, thank you so much.
So someone asked a similar question in the chat about the DBT. I believe you answered that we'll be bringing in an outside agency.
I believe it's Children's Village.
Okay. And we have another question.
Is that in Dobbs Ferry, the Children's Village? People from
I
there?
think they're based out of there, but yeah.
Okay. Thank you.
Okay. Her follow-up was which agency, and you just answered that.
Yeah.
Okay. So any other questions for Dr. Hoerter?
Yeah, I just had the one. Can you just say which grant was funding that expansion? Is it Department of Education?
Which expansion?
The one for the DBT in schools.
Oh, we are repurposing some state aid. It's not a grant specific to DBT. It's just an identified need. So we repurpose some state aid for that.
Great, thank you.
Okay, well, if there are no other questions, I'm going to turn it back to Jackie.
Okay. Dr. Hoerter, that was fabulous. Thank you so much for coming. And we'll see you out in the community and talk more with you as things keep on evolving.
Absolutely.
Thank you very much.
Thank you for having me. Good night.
Good night. And just so you know, if anyone has any further questions that pop up that you think Dr. Hoerter could be addressing, then just as I said before, you can email us at info@namirockland.org, and we will make sure she gets the questions, or we will find the answers. Okay, so now we're going to move on to our second speaker. This is so wonderful. We have Mr. James Norton with us. He is with NAMI New York State up in Albany, and I'm going to tell you a little bit about him. We're very excited to have, much as we love Matthew very, very much, and we're going to love you very, very much. So it's a new person in our lives. So Mr. James Norton joined NAMI in 2025 as the Government and Community Affairs Manager after having spent 10 plus years at the intersection of behavioral health and justice, including roles with the state of New York, state of Vermont, New York State Senate, emergency responders, public safety, and fire. He is focused mainly on the opioid crisis and still works with recovery centers and harm reduction groups. He also continues to work as an adjunct professor of criminal justice. He will be speaking on state of the state and mental health and on NAMI's priorities for New York State. So take it away, Mr. Norton. Thank you.
So thank you all for attending this event and being open to a lot of the programs that NAMI's looking to advocate for. I don't know if you want to pull up the priority sheet, but I can keep going without it. This year, NAMI really focused on 5 priority areas. The first one being access to equitable mental health supports, and followed up with supporting the behavioral health workforce, reimagining crisis and criminal justice reform, enhancing assisted outpatient treatment and voluntary commitment standards and services, as well as addressing children's mental health. A lot of our advocacy this year in the budget was around the AOT issue, but it was also around asking for a 7.8% increase for behavioral healthcare workforce in order to not only keep up with inflation, but catch up from the reduction or the lack of increases of previous years. We've worked on a number of different bills and seen a bit of progress, but it's always more interesting to hear, in my opinion, from the Rockland County leadership and see where the rubber meets the road. Because a lot of what the state does is set policies, set budgets, but yeah, this is where the implementation, which is always the kicker on a lot of these bills. I would highlight a few of our bills have found their way into the budget, whether it was the clubhouse funding or there's the priority of AOT issues, as well as more information on or more support for veteran services in the Dwyer Fund. There's also a substantial increase to OMH. We're happy to see. Unfortunately, we kind of fell short on the 7.8% behavioral health workforce ask. It is actually a 2.6% increase. Towards the end of or as we continue through the session, the implementation of Daniel's Law will be one of the ones that we put at the forefront, as well as Jesse's Law. Actually, earlier today, I was advocating for TDI, which is temporary disability insurance. It's what you take when you might need to leave work for a week, 2 weeks, or more, especially something like a substance use disorder treatment program, the 28-day stay. TDI is the benefit that you get as an individual. It has not been increased since 1989. So we're working to see that increased now. We're also working on a bill for the 988 trust fund. Right now, there is a trust fund set up for 911. You'll actually see a surcharge in your phone lines that goes directly into a trust fund that is then administered to your county emergency services to run 911. We're hoping to see that same model applied to 988. As was just noted, it's still an important resource, and there's still a lot of crisis response. There's still a lot of great organizations who are connecting people throughout the state, and we want to see that continue. I would also note there's a number of federal changes that the NAMI national organization is working for. You'll notice the little top bar here is protecting Medicaid. A lot of the cuts that we're looking at right now are around Medicaid. And it's really unfortunate because about $1 of every $4 that pays for mental health services is from Medicaid. I also asked about the funding for DBT in schools, specifically because there's another round of cuts from the education budget for mental health services with schools, as well as another $811 million from DOJ budgets for reentry programs. So we're looking at a lot of cuts at the federal level and a lot of policies we're trying to see roll out at the state level. As you guys noted at the top, I'm not Matt. I'm the new government and community affairs person. Really since entering the role, I think I started June 3rd, and we had our advocacy day June 13th. Or March 3rd, March 13th. It's been a long budget. A lot of people, I'm sure, are aware that it was late. But I started March 3rd, and we had an advocacy day March 13th. So we kind of hit the ground running on this one. We're definitely already looking down the road as to what our 2026 policies will be, even though we're still at the Capitol, even today, advocating for policies through the close of the session. But going forward, we're definitely trying to do a lot more surveys of the membership. I think that's one of the things I came in wanting to do, and every quarter, there will be a new policy survey coming out from NAMI for NAMI members to take. This will help us decide what bills go to the front of our priorities. There's a host of good bills that get introduced. There's thousands and thousands of bills that get introduced every year. Some of them don't get the attention they deserve. Many of them don't get the attention they deserve. But we can't advocate for 10,000 bills at a time. We have to kind of pick which ones are the most important to our membership, which areas are the most important. We really felt like supporting our workforce was a big one this year. The AOT was a big one this year. And expanding equitable access. I'm amazed and thankful to hear of the dual license program that's starting in Rockland. As somebody who worked with a lot of people who were in opioid crisis, that was a major hurdle for so many people. They would show up to one facility and they'd say, sorry, you got to take care of your alcohol problem before you get treatment for your bipolar disorder problem. And then you take them over to the rehabilitation location and they'd say, sorry, your alcohol problem is self-medicating. And you actually have to go back to the mental health facility and get that taken care of before you can come here for your addiction treatment. As if either one of those things will go away. You live in recovery from those things. And so to hear that there's dual diagnosed programs is great. And I'm hopeful that they will be able to hire staff for both dual diagnosis programming. One of the things that we've heard from a lot of our peer workforce is that, and it's actually a little easier to get certified as a peer in substance use disorders. And so a lot of programs have kind of broken glass in case of emergency and hired SUD peers as mental health peers. And that doesn't always work great when somebody's, say, battling schizophrenia, and then they're paired with a person who has overcome alcohol use disorder. Both people have struggled. Both people have mental health issues, not quite the same experiences. And so the peer relationship is not as strong as if somebody was going through the mental health system as well. I do live and die on questions. I'm always looking for feedback from the membership because much like many of the elected officials, I work for you. I am the person who's paid by NAMI to work on policy issues. And while I have to represent the whole of NAMI, I'm always looking for what areas y'all are feeling need to be at the forefront of our advocacy. Some of the bills that have kind of floated right to the top of our list that weren't necessarily on our priorities this year is there's a bill that requires the New York State Thruway Authority to put in suicide prevention barriers. And if you look at our newsletters going forward, you'll see a link to send a letter to your legislators asking them to pass that bill. And then there was another one today about the Rural Suicide Prevention Task Force. It had passed last year, but was unfortunately vetoed. From what I understand, the issues have been corrected, and we're really pushing for that to go through, but that's definitely something that's on our radar. I do see there's a question, so I don't know if you want to.
Robert?
There is a question from Beth. I don't know if she wants to ask it.
You can read it.
Okay. So last year, the governor had school satellites as a big priority. We don't hear much about that now. Was this reduced? With lack of affordable access to treatment programs for children, it would be another huge blow to our kids.
So I would say it was reduced or delayed. Implementing a program like that takes a very long time. And one of the problems that we've highlighted with supporting the workforce is you do also have to have the workforce to implement these projects. And there is a severe shortage of everyone from mental health counselors to licensed social workers. A lot of the folks that we would want to work with these youth, we have a hard time hiring, especially for the amount of money they're unfortunately paid. There's also questions of who do you contract with, who do you put out your procurement bids for, and that falls to agencies like OMH, but there's also overlap with the Department of Ed. It is not that the program has gone away. It's just the implementation will likely you'll see some of the first stages of that bill coming out next school year.
I see Jack.
Thank you. Yeah, I have a question. It's Jackie here. I know that a couple of years ago, or maybe last year for sure, the governor did add money for a fund to help get more people to go into the, a higher level education for mental health counseling, social work, this and that. And I think there was like a $5 million fund. And now with all of the cuts for student aid and the education department, making sure that people are going to be hurting people who owe money on school loans. Is there any program that you are working towards so that people who want to go into this field can really get it totally paid for, so they're not going to be on the hook for, federal student aid loans? Are you trying to, in other words, can we raise the money in that pot, so that we can get more people into the mental health profession, because there's just not enough?
So I'd say that there's a couple different programs that they could apply to, and I think that's often one of the problems is with putting that kind of student loan forgiveness out there, is making sure people are aware of it. There are programs that you'll find on the Department of Ed website for that, but then there's also a lot of money going into making community colleges free and making SUNY tuition more affordable. That applies to fields that are in demand, and mental health being one of them. There's also a bill we're supporting this year, S1277. It's a loan forgiveness program for mental health nurses that practice in rural tracts or rural areas. So that's another one that we're hoping to see, but it's post-budget, so I can't necessarily say if it's going to get in there this year.
Right. Okay, well, thank you. That's good, because that's the biggest thing, is that we do not have the providers. We do not have enough providers.
And we've been fighting for, with a number of different organizations. There's a whole behavioral health advocates coalition that we're a member of that have been fighting to get more money for programming. But the money that was there to increase salaries for the 2.6 is only on state contracts. So it doesn't increase the amount of money that Medicaid gives you, and it doesn't increase the amount of money that insurance billing will give you. It's just that 2.6% increase on state contracts. Especially as social work and mental health counseling are some of the lowest paid master's degrees. That's very unfortunate. And especially as we now look at some cuts to Medicaid, that's also going to be extremely unfortunate timing.
Okay.
Yeah,
well, thank you.
Not a lot of bright spots on that one, but there is a lot of work to be done on that one.
Okay. I don't know if there are any other questions. I don't want to take up too much time for other
Jossie
people.
has her hand up, so we'll go to Jossie. You're muted, Jossie.
Yes, thank you so much for being here. I'm so pleased. I'm a member of NAMI, and I'm actually a board member of NAMI Rockland. And I go to a program called PROS. I have had a traumatic brain injury, and I need a lot of help and support from the community. And NAMI was the first place that directed me to the program that I go to now, that I've been at for quite some time. And I was just wondering, is there a program that NAMI National has for people who go to programs like I do? I go to a PROS program in Valley Cottage, and a lot of the people there don't have funds to become members of NAMI. Is there some sort of cut rate thing for the people who are like my colleagues right now? They're my peers, and they're all on Medicaid for the most part. They don't have any discretionary funds, as far as I can tell. And I think if they could be part of NAMI as active members, they might feel less helpless, and that maybe they could actually help enact change. In the past, they've been part of letter writing campaigns to Congress people and senators, and they love being part of the scrum and being part of making change in the mental health field, as it directly affects them and their families and loved ones. So I was just wondering if there is some sort of program that can be brought to some of the mental health, I guess, programs in Rockland County or, in New York State.
So yes, there is a discounted rate to join NAMI. The membership dues are $40 a year, but there's an additional form you can fill out that says there's a financial need, and the membership dues decrease to $5.
Uh-huh. Well, I think a lot of people would like that, and they really, the group I'm part of in Valley Cottage, they're fairly proactive people, and they like to see change happen, and so that would be great. I guess I'll go to the NAMI Rockland and try to get those forms.
Chelsea, we do offer the $5 discount on our website, and if there isn't an individual case, we've been able to get some individuals who've underwritten memberships. If on a personal basis, if you let us know, we would never turn a member away for the inability to pay.
Mm-hmm. Mm-hmm. Well, probably a few of them would love to do that, but they might not have access to computers or know how to fill stuff out online or whatever.
If you would like us to come down to one of your meetings, we would come down and we would explain what membership entitles them to, and we can actually sign them up there.
I would love it. We can make a little a morning program or maybe arrange for that.
I think that would be fabulous. And
there's Duanio Pros. There's the Pros in Valley Cottage that I go to, and then there's another program. I don't remember the name of it, but yeah.
Okay, so we'll discuss that. I think that's an awesome initiative, and we'd love to look and see if we can get an underwriter to further that.
Okay, thank you. That would be great. Thank you so much.
You're welcome.
And thank you, Mr. James Norton. Thank you so much.
I see that Anita has her hand up.
Yeah. Well, first of all, James, thank you so much for the information. I'm sorry that we were unable to screen share the website, but I was wondering if you could tell people how they could get more information about what our New York State NAMI is doing, because it is a wonderful resource, a wealth of information. And just like Jossie is saying, there are a lot of people in our community that would like to find out what's going on aside from what we're doing locally. So how could people find out about it, James?
So I put the link in the chat
Thank you.
the Advocacy Day page, and that actually has the document that I was referring to if anybody wants to see it.
Thank you. That's exactly good. Mm-hmm.
And then that if you are a member, there's a policy update that we send out every month now. I started that when I first joined because I wanted people to know what we're doing at the Capitol and see what we're doing, what we represent you, so you should probably know what we're doing. Getting involved, looks like an event like this with a lot of the local leaders, as well as attending our Advocacy Day next year. We're already booking it. It's going to be the first week of March 2026. We're also putting up a youth mental health advocacy day. That's going to be in May 2026 as well. So it's a never-ending battle for advocacy. I already have my eye on 2026 as we try to close out 2025. But part of the planning for getting our priorities in order right now is because we also want to approach some of the state agencies as they make their budget asks for next year. The budget season really doesn't end. It just keeps going on us. So yeah, it's a great way to go to our website, pay attention to the policy updates, participate in the government affairs meeting. And I believe you all have one here at NAMI Rockland. And we try to invite members. We are starting to invite members from all of the local affiliates to the state one, so that everybody through all the affiliates feel like they have a good voice in what we're doing at the state level.
That's great. That's so wonderful. And I appreciated my first initial call that I had with you. You were so welcoming and inviting me to come to other meetings. It was just wonderful. And NAMI does offer so much to people. It's a wonderful organization. Thank you.
I would like to, I know I've got about 5 minutes left. I'd like to open it up. If any of the legislators who are joining the call with us would like to say anything, feel free to jump on now.
Yes. Well, if there actually no, I don't know if there are other questions. If people have questions, maybe Robert knows that.
There's nothing in the chat right now.
So then what I'd like to say is, although we don't typically have legislators speak at our meetings, we do have a particular assemblyman who's here tonight who would like to just say a few things as a friend of NAMI and as a family member. And it is Mr. Chris Ickes. So Mr. Ickes, if you would like to say something right now, we would appreciate you.
Sure. Thank you for having me. I'll be as quick as I possibly can. James, it was great to see you and meet you. I was not able to be there because I was working on a budget when you did come in to my office this year, but hopefully I will get to see you the next time around. The first two questions to James probably would have been a little better directed to me. I think Beth asked about the school mental health clinics. I went right after the governor when she mentioned that. And I said to her that, first of all, as mentioned by James, the workforce wasn't there. She said that every building, every school building throughout New York State could have a mental health clinic, and we know we don't have the workforce to support that. The second thing was that I immediately started getting calls from my school districts saying we don't have room for it. So that ended up being a problem. And then the final thing that I did ask her to, was where's the money? And she said, oh, it was already in their budget, which of course they did not have a clue about, and they were not planning for that. And that is why, at least up in Orange County, I am looking to create a crisis center so that the school districts in the Orange County area will be able to use the crisis center because, of course, mental health problems don't just occur from 8 o'clock in the morning till 3 o'clock in the afternoon, Monday through Friday. And so we wanted to do a lot more in addressing those. So I just wanted to bring that a little better to conclusion. Jackie, you asked about the workforce and how we're going to do that. And I want to expand on what James said. We approved in the budget, which was very late, but we approved in the budget that anybody from 25 to 55 years old who would like to take and get into one of the, as he mentioned, one of the higher demand majors, one of them being mental health, we would foot the entire bill. New York State will foot the entire bill, including fees and so on like that, and that passed in the budget. So that, I think that was a reference of one of the programs that James was mentioning and all. So that's something brand new, and we're very excited about that to help the workforce. To explain from my point of view of what's happened, I'm sure everybody knew that the budget, the state budget, was 6 weeks late. What that unfortunately means is that we have 6 less weeks to pass bills. And we were able to put in priority bills and so on like that, but it's going to be a lot more difficult to get our bills through when we have lost 6 weeks. We did add 3 days on to the end of our session, but 3 days does not make up for a loss of 6 weeks. I was able to put also in priority requests into the budget. I have 3 spots where I can get money, and I want NAMI and everybody to know this. The first spot is in the budget itself, and I did put in requests in the budget, and I did get money. So, for instance, I got access to the home program. I got $4 million there. Disability advocacy program, otherwise known as DAP. I got $1.5 million there. I also got support for students with disabilities. I got $2 million there. So I did receive things in the budget, which I had to request. If you don't request them, you're not going to get them. And so these are things which I knew were necessary that I made requests for. So that's the first spot where I have money and I can get money from. The second spot is what's called programming money. Now, because we ran so late, this ended up being a week ago Monday. We were given our programming money and it had to be declared by last Friday. So that's money that can support any program. Dr. Horton was talking about, you know, some of the programs they were supporting. She can come back to us. And by us, I'm talking about myself. You have two new Democratic legislators now in Rockland County, Assembly people. You have Pat Carroll and you have Aaron Weeder. And they also have the same pots of money to draw from that I do. And
Nice.
then, but programming money has to be more for programs. And then the final, which I will get probably late June, early July, is what's called capital funds. And that's money that I can distribute to people for building, purchasing, and so on like that. So those are the three that I have, and I hope that you keep those in mind in the future. And certainly as long as I'm here, and make requests of me for that. Because believe it or not, with the programming money, I had to go out and ask people to request for that money and all. So, you know, it's something that is available. And you can request these monies any time of the year. Although my programming money was just up and done with, you can request it and it will sit on my desk till next year, till I get the programming money next year. So there's no time limit on those sorts of things. Finally, I just wanted to let you know that we built the state budget with the concept that we were going to get everything we deserve from the federal government. And as you know, we already have been informed of several programs. There was a large grant program, $232 million, which about a month ago was crushed. It was a grant program crushed by the federal government, not given to us. That was those monies supported a mental health initiative program and also a drug prevention program. Both programs, we had to say to them, look, we don't have the money. We can't backfill everything. The federal government gives New York State every year, which they deserve, $400 billion. We do not have the capacity to backfill $400 billion, half of that, or even a significant part of that. So we have to wait and see. We built the budget on the fact that we were going to get everything, and we have to just go kind of by the wayside as these things happen and make decisions. We can backfill some stuff, but not a whole lot of stuff. And then the final thing that I just wanted to say is a lot of times people say to me, what can we do? We're sitting here and the federal government is doing all this stuff. Please understand that there are 7 Republican congressmen here in New York State, from New York State. And one of them, of course, obviously is Lawler. Okay. You and we and I need to call their offices on a continual basis and say, do the right thing for New York. Pass the bills, you know, that we need, and not this one that's coming through right now, as you know, that has $650 billion in Medicaid cuts, I believe. And, you know, saying don't pass that. Don't vote for that. Now, Lawler, like the other Republicans, think they're going places, hope to go places in the future. And the more people that inform them that we disagree with you, okay, and the decisions you're making, means that their political careers are going to come to an end much quicker than they imagine. So that's what you can do, even though maybe some of the other congressmen are not your congressmen, you still can call their offices and say, hey, I'm a New Yorker. You're a federal congressman. You represent all of New York. And I want to let you know that what you're doing is not correct. You need support all these programs. As we all know, they have not found, or I should say, they have not shown us any fraud. They have not shown us any waste. Same thing with us. We haven't seen it. And so they're just making these wild cuts. The last thing I will say, I forgot about this, is that one of the big things that we have, I think James, again, thank you, made reference to it, CDPAP. The governor put into her budget 2.1% increase. We tried for the 7.8, I think it was, James, 7.8% increase. Yeah, and we had to settle for 2.6 at this point in time. So it's more than the governor was willing to give, and so on like that. Now, also with CDPAP, I'm sure you've heard, we have gone from well over 600, almost 700 FIs, which stands for fiscal intermediaries, down to 1 PPL. And that is kind of, that was supposed to be done already by April 1st. It is not fleshing itself out well. We only have 195,000 of the 440,000 workers. PPL has signed up at this point, meaning people are not being paid. And of those 195,000, easily half of them are not getting the right amount and so on like that. And PPL just came out yesterday saying, oh, by the way, nobody can apply for their money using paper forms anymore. You have to use the app. And just like you folks were expressing, there are folks out there that don't know how to use an app, don't know how to use a smartphone. So we're having a bunch of problems with that. Amy Poland has a bill which is going to try to bring back some of the FIs, the very, very good FIs that we had, independent living, access, and so on like that, and allow them to return as fiscal intermediaries. A fiscal intermediary, just quickly, is somebody that the state gives the money to, and then they pay the workers. And that's how that goes. So that's about, I don't want to take up any more of your time because I definitely appreciate you having me on. I will answer any questions that I possibly can at this point.
And a quick plug for the Medicaid cuts in the chat. There's a link to the page for NAMI at the national level to send letters, make calls, add your name to petitions to protect the Medicaid cuts.
Right. So Assemblyman Ickes, I do appreciate all of the information you've given out, kind of in response to Mr. Norton. But I also just wanted to know if you know, we know you also as a person who's a family member who, you know, you have your lived experience. And I just didn't know if you wanted to just say something about that to our group that's on the call tonight.
Well, thank you. I will, and I am very proud of something. My daughter, who has had mental and physical disabilities, resides at Rockland Psychiatric Center. And it was interesting as I was telling her what I do on a daily basis and all. And here in New York, we're trying to be very environmentally conscious. She said, Dad, they don't recycle at Rockland Psychiatric Center. And so I immediately got on the phone with the commissioner and I said, you need to recycle. And I can proudly say she has recycling bins throughout the entire OMH institutions now.
Your daughter is an activist.
Yes. Yes.
Can you tell us any more about the Visitors Bureau and that whole fiasco that we talk about every year with John Murphy about the forms to try to get individuals who can be approved to join that committee to enhance the lives of the people in Rockland Psychiatric and support the families?
Beth, you're being very kind. You said forms. I'm going to say volumes of paperwork that need to be filled out.
17 pages. That was more than probably, you know, any form I've ever filled out in my lifetime ×3.
Right. And the only thing I can say at this point is that those forms are there. I'm working with the commissioner to see if we can't reduce those and so on like that. But to the best of my knowledge, there's been no movement at this point in putting together the actual Visitors Bureau and all. So I can't say much beyond that.
Thank you.
Okay. Well, I would like to thank you so much for coming on. Assemblymember Ickes, we are always so happy when you join us. And I'd also like to especially thank Mr. Norton, our newest best friend in Albany. You know, I think I'm just gonna hand this back to Beth now and let her say goodbye, which is always the hard part of the evening.
It is the hard part of the evening, but what I did want to sort of continue what Jossie had brought up, we are in the middle of a membership drive. We would like to have individuals who belong to NAMI. It is your organization. Your membership could be as little as $5. There is also a $40 membership, and then there's a $60 membership. If an individual, as I said to Jossie, knows somebody who would like to be a part of the agency and finds it cost prohibitive, please let us know, and we will make sure that there are provisions for signing them up. Just quickly, since most of us here are friends of NAMI, NAMI is the largest grassroots organization that supports individuals and their families with mental health issues. We do that a variety of different ways. Things like this fall into both advocacy and education, because every one of these forums, we all learn, even people in NAMI, we learn new things that we carry into what we do every day. Education also means to demystify mental health. We do that like the other night when I went to a Girl Scout meeting and tried to explain to young people how to recognize mental health within themselves or within their friends. And it was amazing to hear young people when I asked him, who would you tell if you weren't feeling good? And one young girl said, one of my friends. And I was like, that's super. And then a couple of the girls said their parents. And I was so happy to hear that, because there are too many people that really are afraid to tell somebody if they're not feeling really well one day. We also have one other program that I just wanted to remind people about. That's our family peer advocates. Those are individuals who have lived experience, their moms and dads, who are trained by New York State to help other family members navigate being the parent of a child who has a mental health or a behavioral health issue. So these are individuals that you can call. They will help you with the IEP process. They will help you just being a voice. If you need somebody, they will be an ear if you need to talk. We have had individuals who have gone to IEP meetings. We have had individuals who have gone to court. We have had individuals who have been on conference calls at night when the BERT team came to the house. These are individuals who are just super family members who want to take the lives that they've experienced and help somebody else. We have bilingual Spanish and bilingual Creole family peer advocates. And that service, like all of NAMI's services, is of no cost to the community. We do that by funds that we receive through New York State and the Office of Mental Health, as well as grants, and as well as a portion of the membership that we keep and fundraising. Which brings me to the last thing. We did mention that we do have our walk coming up. That will be in September. If you are interested in either participating or in volunteering, that is a really big part of what we need right now, is to create volunteers that will help us with everything from our walk to helping our educational programs. We sent out, Jackie helped send out packets to every school in Rockland County. They got a whole packet of educational things. They got little fidgets. They got all these little goodies. And the schools have sent thank yous to us. We have signs outside of every town hall and the county. And last night we presented at the county and gave them information so that it will be an opportunity for them to understand what's going on in the community and what NAMI can do. So at this point, I just will thank everybody, thank our two speakers. James, it's been delightful, and I look forward to working with you again. And Dr. Hoerter, who is no longer here, we thankfully work very closely with her throughout the year, and we're excited about some of the initiatives. If anybody here is new to NAMI, our website is www.namirockland.org. And as Jackie mentioned, if something comes to you after this meeting, info@rocklandnami.org. Our helpline number is 845-359-8787, and we operate that 9 to 5 every day. With that, I will thank everybody for participating, and I look forward to hearing from you. This will be available on our website. And again, if you have any questions after you leave, please just shoot us a message, and we will be happy to add the answers to it on the website, as well as address it to you personally.
And before we end, I see James has his hand up.
Yes, so I wanted to share one additional resource. The School Mental Health Resource Training Center is available throughout all of New York State. And if you guys are wondering what happened to Matt, that's where he's working now. So they offer mental health first aid, and that was actually something in the budget this year. So school mental health first aid courses, and that's an organization that you can reach out to if you're looking for that.
Thank you, James.
And I would just like to say to everyone again, thank you for coming, and also that May is Mental Health Month. It's the big thing, right? But mental health is all year round, and anyone can always reach out to NAMI. Our helpline is year round, so keep that in mind. Thank you very much.
Oh, and I forgot to mention to you one last thing. I apologize. One of the things that we do, which obviously people realize, is we do peer support. So the peer support, the cornerstone of what we do is we have support groups that run in the community. They're virtual and they are in person. We have groups for parents of children under 21, parents of children over 21. We have a meeting that meets in person in the community. We are planning on having a support group come fall. We've already trained the facilitator for individuals who have a personal partner, whether that be a spouse or any type of intimate partner that has a mental health issue. The dynamic is very different. But if you are in a relationship with somebody who has mental health, we will have a support group starting for that. And eventually, I hope also in the fall, we will have a support group that will be a young person support group. We do have a parent support group that runs for individuals who use Spanish as their primary language as well. So with that, I'm going to say thank you. And unless there's any other questions, have a wonderful evening, everybody.
Thank you. Thank you very much for coming, everyone.
Thank you, everyone.
Thank you,
night.
everyone. Thank you so much.
Good night.